Okay, everyone. Thank you for joining us today. Welcome to the Hive Data Think Tank webinar series. We're excited to be bringing you an awesome panel today talking about smartphones and surveillance and contact tracing in this era of COVID-19. But before we begin, I just want to go over a few ground rules for the chat, which I'm going to be chat and the question features for this webinar, which I will put in the chat box. So if people are still joining us, they'll be able to see them there. Please be respectful in the chat. We love questions. Please use the Q&A function to ask presenters questions, which they'll answer at the end. To follow along or contribute on Twitter, please use the hashtag HiveData. This session is being recorded and will be available for instant replay afterwards. And with that being said, I also want to remind people this webinar is not the place to be plugging your startup or asking for personal investment opportunities. So please respect that and be mindful of that. And with further ado, I'm going to tell you a little bit about the Hive Think Tank. And then I'll pass it over to Ravi, who leads the Hive. Okay. Great. So this is the webinar we're going to be doing today, Protecting Lives and Liberties, Smartphone Surveillance in the COVID-19 Era. We have these amazing panelists that are joining us today. And about the Hive Think Tank, we are an ecosystem of entrepreneurs, corporations, thought leaders. We're bringing you events right now about once a week. Today we have 2 events in one day, so I hope you can join us later, which I'll talk about in just a moment. Our events cover a broad range of topics, including AI, blockchain, enterprise, industrials, health, 5G, fintech, and so on. And today, later on at 6 p.m. Pacific time, we're going to be looking at...
I want to advance the slide.
I have advanced the slide. Oh. Are you guys seeing this?
We see the whole of your computer screen, I think, rather
like a PowerPoint or something like that, entire layout.
Oh, okay. Give me 1 minute. Going to do this again. Thank you for the pause, guys. There we go. Perfect. Thank you, guys. Oh, why does it? There we go. All right. So this is the webinar that's going on tonight. We hope you join us at 6 p.m. And then we have another one next week. Is everyone seeing this? The new slide?
Yes.
Okay, great, perfect. So that's going to be a great webinar featuring the SVP and Chief Data Officer of Intuit and the Chief Data and Analytics Officer of Chase. And we'll be talking about data stewardship in an AI-driven world. So that will be next week on the 29th at 12:30 p.m. And a quick thank you to our sponsors. If you are currently in the crowd and you want to find out about being a sponsor of the think tank or working with us for a webinar during this time, we would love to get in contact with you. Please email me at maddie@hivedata.com. And now I would like to introduce TM Ravi, who is the managing director and founder of the Hive, and he's going to tell you just briefly about what the Hive does. Thank you all for being here.
Thank you, Maddie, and thank you, Maddie, for organizing and putting this whole event together. So the Hive is a venture studio and is very focused on creating companies along with entrepreneurs, sometimes with corporations, focused around applications and use cases of data and data-related techniques. And so we're very thematic in our approach. And so you'll see some of the themes out there around business processes, digital risk, which is a topic that we'll talk a little bit about today, Industry 4.0, and so forth. And underneath that, you see some of the technologies that our companies tend to use to address problems in the general enterprise and different vertical segments. So if you're an entrepreneur, we would love to engage with you. And here in this next slide is a view of some of our companies that we have done across the industrial space, across security and privacy, workflow and business processes, and so on. If you're going to be tweeting today, please use the hashtag HiveData. And with that, I'd like to welcome and introduce the panelists. So first, Lydia de la Torre is a lawyer at Squire, Patton, Boggs, and also with Santa Clara Law School. And she has a practice in privacy, cybersecurity, and data protection. This is the second event we are doing together with Lydia. And I deeply appreciate, Lydia, the time that you have spent and bringing together sort of this esteemed sort of set of panelists. Bergstrom is evolutionary biologist, professor in the Department of Biology in the University of Washington, extensive experience in epidemiology of infectious diseases. Many of you in the tech world probably and sort of in the academic world know him because of his courses, website, and his upcoming book Calling Bullshit about information, disinformation, fake news, and so forth. So buy the book when it comes out soon. And finally, Calo, who's a law professor in the University of Washington, and especially for today's talk, will bring a kind of perspective on the intersection of law and technology. With that, I hand it over to you, Lydia.
Okay. Lydia, I'm pulling up your...
Thank you, TM, and thank you, Maddie, for the introduction, and welcome everybody to this webinar. I'm very, very happy to be here presenting and doing my second event with the Hive. I thought, I was given the role of, doing the first slide, and I thought I will start by disappointing the audience by talking about what we are not going to talk about. This is such a huge, fast-moving topic, right? COVID and technology and all of the things that are being done both at the cell phone, smartphone level, and in many other ways that we really wanted to have a concise topic to talk about. So we wanted to highlight for you that there's a number of different apps that are being currently offered and will be offered in the future. We have to move to the next slide, Maddie, please. Thank you. Next one more. There we go. That we're not going to cover in this webinar. We might cover them in future webinars, hopefully. So the first one group of apps will be the telemedicine apps, and these are apps that had typically been in the market for a while that are being upgraded to deal with COVID. And the one that we have here as an example is the K-Health telemedicine app that has been updated to provide information on how to identify your symptoms. There's functionality where you can contact a medical professional, et cetera, et cetera. We're not gonna, in this webinar, tackle telemedicine apps. The second bucket is the quarantine compliance apps. And this is a segment that has created a lot of debate. The example that we have here is the home quarantine app that was released in Poland. This was released by the Polish government. And the idea behind this app is to provide an option for individuals who are required to quarantine under applicable law. And the choices that they have are basically either for Poland is either you accept that you will be visited by the police while you're quarantining in place to ensure that you're complying, or you can download the app. And if you download the app, there's requirements where you have to check in, send pictures, etc. And if you don't comply, there's a possibility of a fine or other type of enforcement action. We're not going to tackle quarantine compliance apps here. The last bucket that I wanted to talk about is research apps. And the example that we have here is the COVID symptom tracker app. This is an app that I think is now available in the UK, but the plan is to release it elsewhere. The idea is to collect information that will help researchers better understand COVID-19 and better think about how to treat it and advise individuals who might be infected. So maybe we can move to the next slide. And Carl, can you talk to us about what is contact tracing, which is kind of the underlying idea here? What is contact tracing? And then we can talk about how technology can help facilitate contact tracing, perhaps.
Sure, of course. So the aim in any kind of pandemic control is to get the number of infections that each infected person generates down and get it down below 1, hopefully well below 1. There are a number of different ways that we can do that, of course. When we have a very, very broad outbreak like we do right now, where we have a fairly large number of cases, particularly in places like New York City, we often have to just implement large-scale shutdown measures, and that's what we're seeing in the United States right now today. As we think about how to move forward and get people back to work, allow people to get back to school, allow people to get back to their lives, we want to think about ways to relax the restrictions that we're facing right now on all of us, and basically target those restrictions more specifically to people that we think are likely to be infected and likely to be transmitting. And so in order to do that, we have this sort of approach of what we call classical containment measures in epidemiology, where we start testing people extensively. And that's going to be particularly important for COVID-19, because with COVID-19, people are able to transmit the disease before they're actually showing symptoms. So it's not going to be sufficient to simply have people self-quarantine once they're showing symptoms. This makes it particularly hard, obviously, to deal with this from an epidemiological perspective. With SARS-1, we were able to control that in part because people were showing symptoms before they were actually able to transmit the disease. So what we have to do now is figure out how do we pick up cases of COVID-19 before people are even showing the symptoms. And we do that by a combination of testing and contact tracing. So on one hand, we want to test as extensively as possible. That's something that we're not yet able to do in the United States. We've not done a great job of rolling out large-scale testing, and people are working very hard on ways to do that, but we're not there yet. In concert with the testing, once you do find a positive case of COVID-19, then you want to make sure that not only is that person isolated from the community, but you want to isolate the people that might have been infected by that person. And that's where contact tracing comes in. So the idea is that we figure out when someone is diagnosed positive, we figure out who have they interacted with during the period that they might have been infectious. We go to those people and ask those people to self-quarantine or impose a quarantine in some circumstances. Here, I think we're mostly thinking self-quarantine, self-isolation, and make sure that those people are absolutely minimizing the chance that they would continue to spread an infection. And then the rest of us are able to get back to life if we haven't been diagnosed, if we haven't been in contact with a person that's been diagnosed, then we can go on with daily life more or less as things were beforehand. So typically contact tracing is done by shoe leather. You have a large, very large number of people who are trained to go and speak to the person who is infected, talk through who their contacts are, kind of walk back through their days, try to remember where they've been, who they've interacted with, were they on a particular bus. If you're going to work at that level, it's particularly tricky because then you've got to, figure out who else was on there, or maybe you're just trying to track down the immediate contacts. Who have you talked to face to face? Who have you had physical contact with? Who have you been in the proximity of for some extended period of time? And then the contact tracers go and they find each of those people and talk through with them about, first of all, see if they're showing symptoms. If they are, then they've got to initiate the contact tracing backward from that point, and kind of, iterate on that. If they're not, then say, well, look, you've had this contact that's become, that has tested positive for the disease. And so we're going to need to ask you to self-isolate and so forth. This can be very effective. It's a kind of a classical, traditional public health infection control measure, but it of course takes an enormous amount of resources, enormous number of people doing this work. So the hope is that we can find a more effective way to do this using technology. You want to talk a little bit about that, Ryan?
Sure. Thank you. So the contact tracing apps are hopefully a way to automate some of the intensive labor that it's involved in doing contact tracing the old-fashioned way. We have two pictures here of contact tracing apps. One of them is in Israel. There's also examples of tracing apps that have already been deployed in other geographies. We haven't done that in the US yet. Maybe we can move to the next slide, and Ryan and I are going to partner explaining this idea of, using technology in a privacy mindful way. Ryan, do you want me to go first, or do you want to take on the initial explanation?
Lydia, if you don't mind going first, that would be great.
I'm happy to do that. I'm happy to do that. Just make sure that you, cover all of the things that I will probably leave uncovered. We were hoping to have a great technologist join this seminar who will have had all the answers to the questions that you might have in your mind right now about how the technology works. Unfortunately, he had a last-minute conflict. So we're going to give a high-level explanation of how this can work. If you have questions that are more on the technical side, feel free to submit them. We will we'll reach back to you and provide resources and try to provide answers the best way that we can. But we unfortunately will not be able to answer live questions that are, very deep in the technology side of this. But the basic idea here, this is a comic that I love. It was put together by a group that is NCASE, and it's basically explaining how decentralized privacy-preserving proximity tracing, the short for that is DP3T, can work. And to talk about the basics here, so your telephone, my telephone, our cell phones, are constantly talking to each other through a functionality that is currently enabled, is the Bluetooth. And this just happens in random periods of time, usually within less than 5 minutes. Your cell phone is sending some form of gibberish around. It's transmitted only to those who are physically near to you and have a cell phone that can receive that signal. And those messages are saved in our cell phones. This functionality was created to enable Bluetooth connectivity between cell phones that are within proximity. So the example that we have here, the yellow cartoon, the yellow rabbit, I guess, Alice, has a cell phone that is broadcasting gibberish random message every few minutes. So if she is in a public space and she sits by somebody who is carrying a cell phone, Alice's cell phone is both sending this gibberish, which is recorded in the cell phone of the individual who is within proximity, and also listening for other cell phones in the area and recording the gibberish, these messages that those cell phones are transmitting. And that goes to that what I said, what I heard list, right? So your cell phone will have a list of what it has said and what it has heard. These are typically saved for a short period of time, 14, 15 days. They are in our device. They don't necessarily go anywhere else. They live in the device. And the idea is to use this functionality to enable tracing without necessarily having to use location data or other types of data that might be more sensitive. So what these apps will do if they are implemented with this decentralized privacy-preserving technology is basically use those lists that are in the app, in the cell phone. And if Alice, in this case, gets sick a few days after having been in public, and she goes into her app and she reports that she's sick, what the app de facto is going to do is going to take that list of what I said, what the messages that Alice's cell phone has transmitted in the last 14 days, and push it up to a repository. That repository will not know where the information was acquired, or where Alice was, who she was by. But if an individual who has a compatible app has this functionality enabled, the cell phone will check constantly against that uploaded list. And the moment that it identifies within that list one of these messages that is in the uploaded list and in his cell phone, it will say there was contact. You were in proximity with somebody at some point of time that has actually reported that he or she now is positive for COVID. So that is the idea behind the functionality. There has been I think, other ways proposed. This seems to be the one that is moving forward. The EDPB, the European main regulator on data protection, released 2 days ago statement that seems to align with this. Ryan, help me out here.
Yeah, no, I mean, I don't think you need any help. I mean, that was a really succinct and, as far as I can tell, as a law professor, accurate description of the technology. The only thing I would want to do is maybe back out a little bit and say there are a number of different ways to track people's location, right? And some of them, like GPS or triangulating where you are on the basis of cell phone towers, for example. They might have a certain amount of accuracy. Federal law requires that cell phone providers be able to locate you within a few feet because of E911 requirements. So if you call 911 from your cell phone, you need to be able to be located by the responders. And so that's a technical requirement that there is. But these kinds of methods will tell the provider of a cell phone or tell the GPS provider or tell whomever you share it with actually where you are. And also where you have gone over time. And so the Supreme Court has noted that that kind of information is astoundingly useful to government to figure out where you are, but especially where you have been over time. And here, it would also be really useful to government. It would be really useful to contact trace with your previous location data. In other words, you say, looks like I've been infected. Where have I been? Well, here's a whole list of where I've been, right? And here's a whole list of all the people that were near me, where they've been. And here's a list of just all the people that I was near. And you can go talk to them because we know where they are. That's not what this technology does. Right? And I just want to clarify that. That's not what this technology does. And so it's quite friendly from a privacy perspective, because all it does is, as Lydia ably described, it just tells you, hey, a daily assigned Bluetooth unique identifier that you're associated with was near a similarly uniquely identified but temporary Bluetooth identification that is tested positive for COVID according to them. That's all it does, right? And so that's a very key distinction, and it has, it's from a privacy and security perspective, while imperfect for reasons maybe we can talk about, it's a far cry from some centralized database that has your current and previous location, which mobile phones are capable of generating, but that's not what this is.
Can we move to the next slide? Thank you so much, Ryan. And I think this is a sign of the times that I thought I will never see. So Apple and Google partnering together, putting their logos together with obviously small line there to make sure that they are still different companies. But they have basically partnered to enable this functionality, meaning create in the platforms that they both control the tools that an app developer, being maybe a governmental authority, being potentially a private entity, can use to put together these apps in a way that both they can be compatible between the two platforms, meaning if I have an Apple phone and you have a Google phone, they still will record this information and let me know if you have been infected, and are also scalable. So this is an announcement, I think it was like 13 days ago. Things are moving so fast in this space, where both companies said we will put this together. By May, we will release an API. In the following months, we will release something more robust that enables the creations of apps that take advantage of this functionality. One thing that we have to make clear is that they will not develop the apps. Apple and Google have said that they will not develop the apps. They will basically do the back-end support so that these apps can be developed. They also have made statements around privacy, transparency, and consent, meaning that they both have taken the position that having this app will be something that you as an individual choose to do by downloading the app and enabling it. It will not be something necessarily that is enabled by default. And I'm not sure, is there something else perhaps that we should discuss here, Ryan?
I was just thinking about that. I mean, you know, this effort is particularly visible because it involves two household name companies that ultimately control an enormous percentage of the mobile market, virtually all of it, right? And so the fact that it's interoperable across these, and their decision is really going to dictate the architecture of digital contact tracing. But they're not the only efforts out there. And, you know, the other efforts are some of them within universities, some of them holding hands across companies and universities. But this is the one I think a lot of people are paying attention to, just because, you know, it's Google and Apple. And also my understanding, and I might get this wrong, is that what the architecture permits in part is for this contact tracing functionality to run in the background and therefore not be as punishing on the battery life, and not be as punishing on processing power, because it's capable of running in the background. Whereas if you use a different app, you can still run it on those phones, but it may not. It may have to operate in the foreground in order to have the functionality that the developers describe.
Thank you so much, Ryan. So we have Google, we have Apple, we have other companies and universities. Does that mean we're done? Is it we're good to go? Let's download these apps and get it going. Clara, what do you think? Are there some issues that we should be thinking about? Maybe we can move to the next slide.
Yeah, so I mean, I think unfortunately, you know, as good as some of that sounds with the way that the architecture is being designed and implemented in a way that can be very widespread and so forth, there are a number of pretty serious problems that have me really worried about the entire concept. One of these is the issue of over-reporting, and there's a couple kinds of things that can go wrong in terms of over-reporting. By over-reporting, I mean your phone tells you that you've been exposed when, in fact, you have not. And so, you know, one possibility with over-reporting is simply that you know, the mobile phone sensors are not perfect indicators of location. They're oblivious to things like walls. So if you're living in an apartment building, your neighbor, who you may not have ever seen face-to-face or contacted in any direct way, may be exchanging Bluetooth signals with your phone. And so if that person comes down with a case, you'll be notified that you've been exposed, even when in practice you haven't. So these are like are sort of, you know, actual false positives where you have a mistake that's made by the system. Then you also have a lot of situations where you may have fleeting contact of various kinds, where the probability of transmission is relatively low, but nevertheless it will be picked up as a possible contact, and you'll be, you know, if a person that you've had even this fleeting contact with has been exposed, you will be flagged. It comes down, is diagnosed as positive, you'll be flagged as having been exposed. So, you know, if you depending on, and partly this depends on how you set up the app to work, right? How much contact does the app require in order to consider it a valid contact? But if we allow, you know, sort of any time that a Bluetooth signal is sent between two telephones, then that's going to pick up people that you walk by on the street, people in the grocery store, somebody pumping gas next to you, whatever. And if you have that level of sensitivity to a system like this, then you know, with even relatively small levels of infection in the population, say 0.5% or 0.25% or something like that, you know, ballpark calculations suggest you'll be spending half your time in self-quarantine, simply because these interactions are being flagged. I should back off of that. That's going to be a problem even if you have longer term interactions. There are kind of distributions of I misspoke there. There are distributions of the number of contacts that individuals have, and they're sort of long-tailed, but the average number of you know, sort of protracted contacts, which would be a 5-minute face-to-face conversation or physical interaction where you touch somebody, that's going to be about 12 per person per day during normal times. Then, of course, but very wide variance around that. So even if you're only flagging those, you're still going to have people, you know, with a relatively low fraction even if you have only flagging those, even if only a relatively low fraction of people who are infected in the population, you're still going to be spending quite a large amount of time in self-quarantine, up to half of your time. If you extend that to all the fleeting interactions you have, walking by someone on the street and so forth, then if unless the disease is extremely rare in the community at the time, you're going to be getting flagged essentially all the time. So that's the over-reporting side of things.
So we have to be concerned about basically a positive that's not a positive, right? I was biking by somebody, I really didn't touch that person. They came by really fast, and then I get a message, you've been infected. I might not be infected. What about the other side of this? If I know that I have not received any messages from my app indicating that I have been in contact with somebody that is positive, can I be then sure that I am in the clear? Maybe we can move to the next slide.
So this is an absolutely key thing to recognize as well, is that these contact tracing apps never provide someone with the certainty that it's safe to go out and interact with the public or with their family or anything else. They can't possibly have the sort of penetration and the accuracy to tell you that you're definitely not exposed. And there are a whole bunch of reasons for this. I mean, first of all, only about 4 in 5 people are carrying a smartphone at any given time. You won't necessarily have anywhere near universal uptake on the use of these kinds of apps, and they won't work if the other person who you've contacted is not running the app. People don't carry their phones with them necessarily. There's an example here: a delivery person brings you a pizza, leaves the phone in the car. You don't get that you don't register that contact, even though you've exchanged, maybe even touch, shook hands or talk to one another face to face, or whatever the case may be. So you have all of those kinds of issues. A lot of the fleeting contacts, if you do flag the fleeting contacts, as we talked about, you'll basically, your phone will be lighting up red all the time saying you've been exposed. If you don't flag the fleeting contacts, you're going to miss a lot of transmissions. You're jogging in the park, someone jogs by you the other way, they're leaving a cloud of exhaled particles in the air. You're breathing some of that in, and if you don't flag those, then you're going to be, which I think you can't, if you're going to have this work, then you're just going to be missing all of those kinds of transmissions. There are problems with some groups may not carry cell phones on certain days. I think that's the illusion in the graphic here. You have one of the ones that I'm really concerned about, of course, is you have a lot of what we call fomite transmission for the coronavirus, where fomite is a surface with particles, infectious particles on them. So if somebody coughs on a surface, and then maybe at the table at the cafe before you, the person coughs on that or sneezes on that or just touches it with contaminated hands. You come, you sit down, you touch your face, or you're eating or something like this. At that point, you've got a transmission event that's occurred, but you've never been in the same place as the other person at the same time, and so there's no opportunity for the cell phones to sense a signal, and so you're going to miss all of those fomite-based transmission events. So it turns out you're going to miss. On one hand, you're going to have all of these false positives where you're going to have where you've been. Where you potentially walked by somebody or potentially interacted with somebody but weren't infected. And then you're going to have all these false negatives where people have been infected with someone that they never had a chance to exchange these Bluetooth signals with. So, we've got problems in both directions. And I guess one thing to really stress is that absolutely this cannot be used as some sort of guarantee that it's safe to go out. Yeah, all you're trying to do with these sort of apps is, it's just kind of shift your thinking from an individual-based perspective, where this is my personal key to safety that's going to protect me from this disease or let me know when I've been infected, to thinking at a public health perspective. Basically, you're trying to just enrich the pool of people that we think might possibly have the disease, so that we can extend stay-home orders to a narrow set and relax that elsewhere. And you're doing that with the full knowledge that you're not going to catch everything.
Thank you so much. So fundamentally, if you start feeling that you might have the symptoms, this is no substitute for your doctor right? Call your doctor, even if your app is telling you you are in the clear. And the other way around, like if you are getting an alarm from your app, don't necessarily assume that that means that you're gonna be infected. There could be situations where that is not the case. Is that all of the things that we have to worry about, Ryan, or are there other
Lydia, I just wanted
areas?
to chime in with one
Yeah.
other thing on that, which is that with respect to uptake on these apps, you can see people starting to use them. If you get these false positives where people are being flagged as exposed, and I because you have to realize with this disease, most encounters don't lead to transmission. People are infectious for at least a week, probably longer. Even when people weren't taking all the social distancing precautions we are now, people were still only transmitting to 2 or 3 additional people on average. So the vast majority of the interactions that infected people were having were not leading to transmission. And what that means is that the vast majority of the time that you're getting flagged by the app, you're not actually infected. And so what's going to happen, in my opinion, is as people start to use these apps, the app will say, hey, look, you've been potentially infected. You need to self-quarantine. You'll stay home. Nothing will happen. You'll take 2 weeks off of work, 2 weeks off of doing all the things you want to do. And you'll start to be a bit doubtful. You get flagged a second time 2 weeks later. You stay home 2 more weeks. And then again, nothing happens. But at that point, you say, screw it. This is not, I don't believe this thing anymore. This is useless. And I think you're going to find people, falling off there.
That is a great point, Carl. Thank you so much. Maybe we can move to the next slide. And Ryan, can you highlight other things that we should be thinking about as we think about using this app?
Yeah, and these slides, which Carl and I didn't prepare, but they're based on a lot of the conversations that we've been having, and they're great. So one of the things that I worry a lot about as a person who's been around tech law and in particular privacy and security is that when it comes to privacy and security, that we're sort of robbing Peter to pay Paul. And what I mean by that is that when you decentralize, that's really helpful from a trust and privacy perspective at one level, because there's no repository of everywhere that you've been. You know what I mean? And so that's nice, because then that data can't be used, can't be repurposed. It's not like the police can say, I kind of think that maybe it was Carl behind that bank robbery. I wonder where he was that day, and then go in and look and see where he was based on his use of an app. Do you see what I mean? Like that's helpful. But if you decentralize, you also create other kinds of potential vulnerabilities, both security, and Carl and I both are affiliated with the Center for an Informed Public at University of Washington, which studies misinformation and disinformation. And I also worry about the prospect that this app will become, that some of these apps will become a vector for disinformation and misinformation. So on the security side, this comes from my conversations with Ashkan, who couldn't join us at the last minute, as Lydia mentioned. But because your device is sitting there saying, this is my ID today, this is my ID today, this is my ID today, and that's being captured, right? Coupled with, if you report positive status for coronavirus, it's saying, this is my ID today, and by the way, this person has COVID, okay? And so because that's the way that the system works, it means that a dedicated attacker could sniff in public for those kinds of unique identifiers, the daily Bluetooth key, and which is associated with COVID status, and then just associate that with public, and then figure out that person has COVID-19, and maybe perhaps Ashkan suggested take a picture of them. And so therefore you would have a public camera that could then take pictures of people, and then when a person became associated with COVID status, have a picture of a person with COVID status. Now, that's a pretty involved, expensive attack, but it's just an example of the way in which when you address one concern like centralization, it's possible to introduce the other. The one that I am most worried about, though, is that the instantiations of the contact tracing that I've seen, automated contact tracing, don't have a good solution to what happens when people pretend that they have COVID. Now, why would somebody do that? Well, imagine that you're a political operative and you would rather people did not vote in a particular district because you know it to be quite opposite to your own interests, political interests. Go around reporting status as having COVID and just go all around the area where the polling is taking place, and make sure that everybody who has an app knows that, gosh, that's a place to stay home because there's a lot of the COVID, right? So that's one possibility. Another possibility is, and I hope there aren't people out there like this, but I suspect that unfortunately there are, you're really desperate that your business is not doing what it used to be, selling food. So what do? You go to all your competitors' locations and you show positive status for coronavirus. If you want to scale that up, you could imagine foreign interference, foreign operatives who do a kind of denialist service by flooding the system with false positives. Unfortunately, we live in a world where people will just do that for fun. And so if you don't address the problem of how do you deal with malicious activity on these systems, then you wonder whether they have the potential not only to be inaccurate and to give people a false sense of reassurance or panic, but actually be a vector for attacks on our political and economic and social infrastructure. Now, the API that is, again, most prominent, Google, Apple, it's not an app itself, as Lydia already said. It's a framework. It's an API. It doesn't force apps on the system to deal with the crying wolf issue that I can tell, right? And so until you address that and you make it impossible to use the app unless you've actually been diagnosed, so that the health status, for example, has to be uploaded by a trusted source or verified by a trusted source, you unfortunately run into these kinds of attacks, and they are worse than doing nothing because they create the possibility of mischief. And I think it's only a matter of time. If people start to download these apps, I think we will see things like this.
Thank you so much. And this brings us to a topic that's near and dear to my heart. Maybe we can move to the next slide, which is the law and policy, right? Technology is great, it solves for a lot, but we can't solve for everything with technology. And I think that this is going to be very driven by, the needs are going to be very driven by the underlying legal frameworks in the different areas or in the different regions where we're trying to combat COVID. And so when you think about, for example, the European Union, they have a right that we do not have in the US, or I guess I'm European and I'm in the US, so I'm not sure which is my affiliation, but in Europe for many years, they have had a right to data protection. And this is an additional right to your right of privacy, very, very connected. But basically, it has led them to create a very resilient, very comprehensive framework that already has a lot of these safeguards built in. And the tendency that we will see there is for the enforcement agencies and the government to rely on the safeguards that have already been implemented into law. And we're talking about limitations on collection, et cetera, et cetera. But even for them, they might have to consider additional safeguards that we have highlighted here, like judicial oversight, sunset provisions, data retention is potentially already covered, expressly prohibit economic and social discrimination might already be covered. In the US, we have a different universe that we're dealing with because we don't have that comprehensive resilient framework in place. And we have some states that have been more active, some states that have been less active, and most of the regulations actually apply to the private sector. So when you look at the ability of the public sector to eventually collect this data, it becomes even more clear that we need to think about safeguards. We do have in the US at the federal level an act that regulates how the federal government deals with the data. Is from the 70s. It's really, really outdated. But when you think about who is fighting, who's really active in fighting this pandemic, you have to think about the states and the local government. And there you're going to find that a lot of states might not have a framework, and the federal framework doesn't necessarily apply to them. In California, we have a framework that's, I think, from 1977. It's not an area where I practice a lot. It's a complex space, so I don't know all of the details, but my knowledge, based on the work that I have done, is that it's outdated and it is not ready to really deal with the safeguards that give us confidence that the safeguards that we need are in place. And when you go one level down and you think about your county and your city, and they will be fighting and they will be collecting, or they will have an interest in a lot of this data, even the state level framework might not apply to them. In California, our state level framework doesn't apply to our counties and doesn't apply to our cities. So we really have to rethink how we're doing those, how we're approaching the legal frameworks for data in the US. This is something that has been in the minds of privacy advocates for a very long, long time. But every situation that drives data collection kind of highlights this need. Another thing that has been talked about is the idea of open source, meaning these apps, if they are developed, they should be open source so that they can be tested, so that we really know what the app is doing, what the app is collecting, what the app is doing with the data. The last point that I was going to mention is the idea of opt-in, right? When I was talking about the announcement from Google and Apple, they did stress the idea of privacy, the idea that the download the app should be voluntary. But there's a policy question that this doesn't solve, which is, what are we going to use the app for, right? If your employer is going to require you to show that your app doesn't have any report of contact with somebody who might have had COVID to work, maybe it's not voluntary. Maybe you need it because you want to work, because you want to get a check. Same thing with your local supermarket, et cetera, et cetera. There's infinite examples of situations where theoretically this might be opt-in, but you need it in a way that de facto doesn't let you make that choice in a free way. Ryan, I want you to also comment on this. I know that you have been thinking about this for a while, and I look forward to hearing what you're thinking in this space.
Yeah, thank you so much. I mean, I think you framed the issues wonderfully, and I noticed we have a long and really interesting queue of questions, and I may actually try to address a couple of the things just in my remarks briefly. So I think what's most important to understand is that automated tracing of the kind that many, but not all, apps envision, wherein you associate Bluetooth location, Bluetooth proximity data with positive status, that has all the kinds of limitations that we've been talking about so far, right? And that the law can and should require that people who make apps or make the platforms that these apps run on should have to be overt and express and warn people about those limitations, and that anything else is, I think, somewhat irresponsible. Now, there is another effort we haven't talked much about, relatively new. I've just gotten to start to understand it, but it's by, it's a team at Microsoft, and it's a team at the University of Washington. Now, let me say that Microsoft is a major funder of my lab and at the Tech Policy Lab, and a great partner in that. And I work at the University of Washington, and so does Carl. That said, the name of the app is COVID Safe. And it may mean that they may mean to say that it's safe from a privacy perspective. And there I actually say that it's relatively safe from a privacy, that architecture of using Bluetooth in this way. But it won't keep you safe by itself. And you shouldn't think it does. And so I think the people that design these things, our colleagues at UW, Microsoft, Apple, Google, all the other people that are doing it, should just be first and foremost really upfront about the limitations, and that the law might require that. Number two, if we really want to get the benefit of the fact that we're also technologically mediated and that we're carrying around a tracking device in our pockets at all times in order to combat coronavirus, that might be all right. I mean, I'm not an elected official. I don't know what kinds of trade-offs you're willing to make. But if the idea is that you're willing to give up privacy and civil liberty to be safe and to avoid getting infected and to avoid vulnerable people getting infected, that's a trade-off that may make sense. That might make sense. And if we want to empower people, like the UW and Microsoft app, for example, supports manual contact tracing of the kind that Carl, I don't know if precisely the kind that Carl described, but it allows you to do it with people as well. And so that ability, that affordance could be really helpful. So if we want to use these apps to track people down and make sure they're quarantined and make sure that we figure out exactly who they talk to for a long time and had contact with, maybe that's a good idea. And one of the things that law and policy can do is not make the privacy and civil liberties go away, but help to defray the privacy and civil liberties concerns by putting in structures in place like judicial oversight, like sunset provisions, which mean that after a period of time, we have to renew the efforts or they go away, or data use limitation, where you cannot use the data that you gathered to fight coronavirus for some other purpose. You can't monetize it or use it for law enforcement purposes that are not what it was gathered for, and so on and so on. But as Lydia alludes to, one of the hardest things is going to be discrimination. The idea that these apps will be voluntary in fact, voluntary in theory, but in practice mandatory, because you won't be able to go to the grocery store, you won't be able to go to work. This is something that Ashkan Soltani has brought to my attention, I should acknowledge, and it's a really serious danger. There is a paper by a law professor named Scott Peppett that talks about the process of unraveling your privacy, where things look like they're voluntary and opt-in, but eventually they become necessary for you to live your life. And the example he gives is the way that you pay less for insurance if you let them follow you around in your car and see how you're driving, right? Initially that seems like, oh, I can get a discount by participating in this Safe Drive program, but eventually it becomes so cost prohibitive not to do that, that you functionally have to, right? And so, what can the law do about that? I don't know. I mean, I think there are ways that the law could say, state or federal law could say, you may not premise coming to work on someone showing you their app, or you may not do this, you may not do that. Anyway, that's the picture, right? There's these apps, however cleverly designed and by whom, they're not going to get us out of this Hobson's choice we face between being at home and socially distancing and risking the coronavirus. They're just not going to do that, right? They could help at the margins, but they're not going to get us out of that. To get us out of that, we need widespread testing, and we may need some relatively invasive government practices to make sure that we're testing the right people and that the people that get tested and have contact with others are appropriately quarantined. I can't tell you what those trade-offs ought to be, but the law at most can help to cabin the effects, and I'll stop there.
Thank you. Thank you so much, Ryan. And it's complicated times. I don't know that anybody has all of the answers, but I think it's also very interesting times to bring people together and think through the solutions, both on the technology side, on the policy side, on the science epidemiologist side. So this was a fantastic panel. I wanted to give Carla an opportunity to give us some thoughts to kind of wrap up this conversation before we go into questions. Carl, do you want to take the stage?
So I think, awful lot of people in the epidemiology community working together with economists and many other people to try to think about how we can get the United States back on its feet and get ourselves back to work and get schools open and all of that without having a terrible resurgence of the disease, which at this point is looking like would be an absolute disaster given what we know about the fatality rates and so forth. There are different approaches to how to do that. I think they almost all involve extensive testing. And so, one of the things that we're going to absolutely have to do is figure out how to test large numbers of people in efficient ways. And there's technological issues there, but there are also sort of organizational issues to how you do that. I think what we can then do with that is then try to supplement the effects, the value of testing, of extensive testing with any kinds of approaches we can think of, including technological solutions. And so while I think that there are a lot of problems that we've just discussed about digital contact tracing today, I don't want to rule it out entirely because there may be ways for that to provide some sort of marginal benefits to society if we can think of clever ways to use the technology. It is really key, though, not to view it as a panacea or even to view it as a replacement for manual contact tracing, and to think through the issues around false positives and false negatives in a way that will be, in a way that will prevent us from deploying a product that is going to cause more harm than it does good. With contact tracing, typically, contact tracing is typically most valuable in what we call the containment phase of an epidemic, which is the early part of an epidemic where very few people are infected. You're trying to spot the infectious cases as soon as possible, and you have a little flare up, if you will, a little wildfire, little spark, and you want to put that spark out before it spreads up into a big conflagration. This is where we were, say, in February. We typically don't think about using contact tracing as much when you're right where we are now, near the peak of an epidemic. You've got it very widespread in the country. It doesn't mean that it's useless, and there may be ways to even get marginal gains from contact tracing type applications when you're at very, very high frequency or relatively high frequency in the community at large. But when you do that, you've got to very carefully weigh these false positive and false negative rates so that you're not flagging everyone all the time just because there's so much prevalence in the community. So you have to tune that, if you will, and have to think carefully about how that's going to be done. As you bring an epidemic back down, if we're able to do that, we can get back into that same domain that we were last February, where you may have in a medium-sized city, you may have 0 cases for some period. And the hope very much is that we'll be there by some point in the summer. And what you want to do is then catch the cases early when they do come in, because it'll still be simmering in various places around the country. You'll have people moving around. When those cases do start to flare up, you want to catch that as early as possible and tamp that out so that you can keep the community prevalence extremely low. When we get back there, that's where contact tracing gets back again into this containment domain we could have thought about using last February, and that's where these apps can be more valuable. This is obviously works a lot better when they're a very, very small number of cases, and so you don't have to worry too much about the false positives become less costly if you have a bunch of false positives, but you have so few for each infected case, but you have so few infected cases that those false positives don't cover a very large fraction of the population. So looking at this as sort of a maintenance strategy, once we get the pandemic down to low levels, could potentially be useful. I think in general, the key thing with all of these apps is to think of them as public health interventions that are statistical, that are on the margin, and they're not actually providing a huge amount of individual safety to the users. And so that raises a whole set of issues around how do we create the incentives that users need to actually install these things. Why would I want to have this on my phone when it's not keeping me particularly safe? It's not keeping my family particularly safe. It's helping the community on the margin, but every now and then it's telling me I've got to give up 2 weeks of pay. So thinking through all those incentive problems becomes really, really important when we consider the use of these applications. And so, I guess overall, I think that they have the potential to be useful as public health tools, but they have to be viewed in that right context. And I think, I have yet to hear proposals that really deal with the suite of problems that we'd be facing. I just conclude, I guess, by really stressing something Ryan said, is that the I am quite concerned about the risk of these being vulnerable to various kinds of malicious attack. I spend a lot of time studying disinformation on social media in particular, but disinformation more broadly, and watching that around coronavirus. And there's extremely strong evidence of concerted foreign actors, concerted campaigns by foreign actors that are pushing disinformation into the American conversation and causing all kinds of social disruption in that way. So I think it would be amazingly foolhardy to expect that you could deploy something like this on a large scale and not have it be the target of well-informed, well-funded malicious actors. I guess that's a really negative note to end on, but I'm out of things to say, so there we are.
Thank you so much, Carl. Thank you so much, Ryan. I hope everybody has learned a lot from this webinar. I certainly have. Before we move on to questions, I just wanted to say that this is a webinar that is likely to not age well, in that this is such a fast-moving area. If you have an interest, stay connected. Some of the concerns that we have not raised might be very important concerns moving forward. Some of the concerns that we have raised might be tackled through other actions, like Ryan was highlighting, the idea of policy, the idea of law, etc., etc. So we hope that you have enjoyed. We hope that you are much more informed. We're going to move into questions, and I know Ryan mentioned that there were a couple of questions that he wanted to take on. Ryan, do you want to help us with that? I think that we have to move into a different.
Yeah, and I should just say that I warned the panel before that I might be interrupted now as of noon. I mean, one thing we already talked about, there was a question about being clear that some contact tracing apps follow the privacy preserving protocol, but not all of them. An anonymous, no surprise, anonymous attendee said that, and that's absolutely right. I mean, there could be contact tracing apps that are really invasive and poorly designed from a privacy perspective, and maybe not even get us much. That is to say that they wouldn't even be the kind of thing that you trade your civil liberties and privacy and you get a better result. They could be just as bad a result, but very poorly architected from a privacy perspective. So yes, and that was one. And then there was somebody else who had suggested that if your phone is your phone broadcasting Bluetooth, even if you set it to not discoverable in Bluetooth settings? I think the answer to that is, although I'm not a technologist, that it wouldn't be broadcasting, but then the app wouldn't work. Because I think the Bluetooth has to be discoverable for the app to work. Anyway, those are the two I wanted to answer, but I think also Carl had identified some that he thought were good.
Well, I'll just pick up two that are sort of right at the end of the question list. Chantal Couturier asks, about alternative solutions to this kind of approach, and then there's a question about what tools would I like to see developed by tech. I think definitely the alternative solutions like wearing masks in public, these are another way to get some benefit on the margins. They're kind of like contact tracing apps in some ways, because they don't provide a tremendous amount of, they provide more help to the population than to you yourself. When I go out and wear a mask to the supermarket, unless I've got an N95, which I'm not wearing in the supermarket, but I just wear the cloth masks that I do. What that's mostly doing is preventing me from leaving respiratory droplets around the supermarket, and the air is still coming in around the sides of the mask and so on. But it does have this benefit on the margins, and it does help the community as a whole keep the transmission rates down and hopefully keep the disease from expanding. So I think we can try to think about, so I think those are extremely important. I tend to prefer those to, assuming that we're going to have some, miraculous tech solution to all of this. The same comment, talks about user facilitated notification or something like this. So the idea that an app can help you remember who you've encountered and help you contact those people. And I do think that kind of thing could be very, very useful. So I'd like to see people thinking about how to develop contact tracing apps that help people opt in to, once you find out that you've been infected, that kind of help you go and if you choose to, notify people that you've contacted, perhaps anonymously. That raises all the problems around griefing and that kind of thing. But I think, more likely, actually, just, if I were infected, I would want to, despite the, embarrassment or guilt or whatever, I would want to contact people that I'd been, directly having contact with and let them know, look, I'm sorry, but I've come down with this, and you need to watch yourself for symptoms and self-isolate and that sort of thing. And so applications that could help me choose to do that, if I choose to do that, would be very useful. Similarly, thinking about applications that could help, human boots on the ground contact tracers do their work might be very, very useful as well. So I guess those are the kinds of things I'd like to see working. The reason I laid out a bunch of problems that I was very, very concerned about, but then I didn't say, that this entire thing is a complete mess, and that's because there's a lot of very, very bright people out there that can come up with all kinds of solutions that I haven't thought about, and I'm hopeful somebody will come up with something. So I don't want to say that digital contact tracing is impossible or that apps aren't useful, but it's just that I see this huge set of problems with the ones that we're looking at now and the designs we're currently thinking about.
Right. I also wanted to comment in a few questions. We have a lot of questions and they are very interesting. So sorry we don't answer the specific questions that you put in there. We will try to get back to you. One clarification is we haven't been speaking as to any specific app. Our conversation was around the underlying technology that is privacy preserving, that seems to be, getting ahead and being the one that has been recommended mainly by the European Data Protection Authorities. Unfortunately, we do not have anything equivalent in the US in terms of, an agency that will help us, get quickly guidelines on how we have to operate in the country. But that's one clarification. This is not a conversation about any specific app, but about this technology and this potential solution and the points that can be raised that should be considered as we implement the specific apps. The other thing that I wanted to mention, and this is in one of the questions, is the question was about, how do employers think about their responsibility as we start sending people back to work? And I do actually have a number of clients that are operating in the essential activities area where they are right now still basically open. And it is a very, very, very complicated question for employers right now, in part because it's new, in part because none of the policies and procedures that had been developed to align with what we're seeing right now, because nobody anticipated this situation. But in general, there's a couple of things. One is they're obviously concerned about the safety of their employees. They're also concerned about their own responsibility and individual liability, depending on how they roll out measures to operate in this environment. And these things sometimes, there's a tension there where you don't want to be in a situation where you might discriminate. And we do have a number of laws in the US that we will protect employees against discrimination that could be triggered by measures that can be taken by employers. They are looking at their insurance might not cover them if a situation arises where somebody gets sick because they were asked to work in an environment that was not safe. They are also looking at their privacy policies and how they, and Ryan brought this up, how they inform their employees about what kind of collection they are doing. So they do have to take some measures to verify that the employees are safe. They might not necessarily be requiring employees to show the app. I will advise against that. We don't have those apps implemented in the US, but I will definitely advise any client against taking that stand. but it's a very complex area for employers to operate in right now. Do we have time for more questions? I know that we are close to the end, and Maddie and TM Ravi had some thoughts that I wanted to share at the end.
I think we have a few more, 5 more minutes.
Okay, I mean, I'm just answering some of the questions from my own perspective on by typing them in. But there was a question from someone about whether or not Americans will be asked to share their location information by Julia Lindsay. And you know, I think that that's a very distinct possibility. That is to say that in some jurisdictions, I don't think there'll be a federal program like that, but I think in some jurisdictions you may be asked to, if you are positive for COVID, to share your location information, and that your phone could let you do that. In fact, you know, currently there are apps that come with the Apple phone that allow you to share where you've been if you want to. You know, you can say where you are, you can say where you've been, you have a record of it. And that could help if memories are imperfect, or if there's lots of reasons, right? But at least there's a good thing about American privacy law, which is in the last few years, the Supreme Court has been very, very clear about how important and sensitive location information is. And so the government would need your permission, and would need a warrant in order to get your historical location information after the Carpenter decision. So that's actually a good thing. That is to say, like, you know, there's all this great language in Carpenter. I ended up quoting a lot of it in my U.S. Senate testimony a couple of weeks ago about this set of issues, about how you can paint a whole vivid picture of someone's life by seeing where they've gone. And so at least there's that, right? So the government's not likely to be able to force you to give you location information, but they may ask you for it. And in extreme cases, when a crime has been committed or something, they can get a warrant, but then a judge has to sign up on you getting the information.
Right, thank you, Ryan. I'm not sure if we have time for more questions. The one thing that I was going to mention with what you highlighted is that the importance of restricting secondary uses for this data, because there are ways in which the data can end where, you know, with the government, with private entities that might not have the right to initially collect it, but they have the ability to acquire it. So it's extremely important to think about those limitations in secondary use in the context of the answer that Ryan just provided. Do we have time for more questions?
Maybe one last question. And then
we have a lot of questions, I should say. We have like 15 or 16 great questions.
I'll jump in on another one from an anonymous attendee. This is the issue about if the privacy preserving protocols don't reveal a location, then how can location-based attacks occur? I think it's a good question. Ryan, if you have other ideas, you should jump in on this as well. But what I definitely had in mind was that you would have the way you do location-based attacks would be through actually seeding that location with you know, having a phone physically there. So you'd have a person or a set of people with a phone that would move around that location. You know, say you're trying to perhaps drive down voting in one particular district, you would have somebody you know, in the supermarket all day with a phone that was transmitting, and then
or 10 phones.
Or 10 phones,
yeah.
and then the day before, you know, the day before the election, then you hit infected on those 10 phones, and then they send out the message there. You know, you could also imagine, given the power of some of the sort of you know, liberate movements, if you will, in the United States, you could imagine a liberate.app that you put on your phone that deliberately tampers with this, and that could be portrayed as an act of civil disobedience. And so there are all kinds of problems that could arise along these lines.
Ashkan had in mind, sorry, Lydia, Ashkan had in mind a remote attack too, but I can't describe it faithfully, but maybe that's a question people could direct to him.
Right, that I was just going to mention that, if you have been operating in the cybersecurity area for a while, whether, in the legal field or elsewhere, it is fairly clear that people have, a lot of imagination. So we're just asking, I think mainly, but also Ryan and Carl, we're just giving examples of potential vulnerabilities. People who operate in that space are, will use their imagination, and they will come up with a lot of other potential vectors, and we have to have that in mind.
Great. With that, I'd like to thank Lydia, you for the extraordinary effort that has gone into putting this event together from your side, and Carl and Ryan for participating. Please join us also tonight. We have an event at 6 p.m. on innovation opportunities in the COVID-19 era, and it's a kind of a US and Asia kind of different perspectives. Kind of there's going to be a look at that, and I'll be speaking at that. And next Wednesday, as Matty had mentioned, the Chief Data Officer of Intuit, along with the Chief Data and Analytics Officer of Chase, talking about the dangers associated with trying to extract value from data and what to be aware of, and various technologies like homomorphic encryption and multi-party secure computing that can help address some of the problems. So thank you all, and the audience for amazing questions, a good, I would say 26, 27 questions. And I hope we got to most of them.
Great audience. Yeah, thank you.
Thank you.
Thank you.
You guys.
Thanks, everyone.
Great rest of your day.
Bye now.
Be safe.